Hearing the words, "you have cancer," can be quite shocking, not only for the person being diagnosed, but for their family as well. In our continuing Be Well series on cancer, IdeaStream's Lauren Wilson has the story of how two families deal with the emotional toll of that disease.
I was in the 6th grade at the time, and it was shocking to hear it. It kind of didn't really hit me for a while.
It's just this rattling thing. It's the, you never think it's going to happen to you.
You know, the expression, your mind is blown, that's kind of where I was.
There's no question that the disease is overwhelmingly taxing on a patient. But cancer's emotional effects are far-reaching, extending to both close family and friends who can also exhibit high levels of depression, anxiety, fear, and fatigue.
So when an individual is diagnosed with cancer, it really impacts everyone in their circle, in their support network, in their family.
Hey Wyatt, can you come down for a second?
Bernadette Scruggs is a 2-time breast cancer survivor, and when she received her initial diagnosis, she had to tell her 2 young sons whom she was taking care of as a single mom.
I didn't have a script on how to do this right, and it's just, I need to tell them, they need to know.
At that point, I was still operating that my parents were invincible, that nothing could kill them or take them from me at this point. And it was a really sobering moment. I mean, I'm thankful that I had my brother to talk to and sort of bounce my emotions back and forth off of.
Having someone to lean on and bounce emotions off of was important for Derek and Ashley Culver as well. Their loved one, Jackie Culver, was diagnosed with stage 4 ovarian cancer 4 years ago.
Jackie and I used to kid about the fact that during her treatment, we spent our vacation in Cleveland Clinic. Because literally I would take time off, as did Ashley, to be with her in the hospital during sometimes 1-week stays, sometimes 10-day stays, sometimes 2-week stays.
Some of what happens during treatment is the energy really gets directed at getting to appointments, dealing with the treatment. You know, at the same time, there are these emotional reactions that the family is experiencing, but they may not really feel that they have adequate time to process that.
It's not just that it's hard work, it's that it's emotionally really hard work. Cancer's not going to follow your rules or anyone's rules. You know, it's this, you are kind of a prisoner of these milestones. Emotionally, I would say that roller coaster was filled with anxiety, frustration, you know, anger for sure, sadness always. You know, there was just always emotional fluctuation and always a lack of certainty.
Many patients and families struggle with this uncertainty about the future. Experts say communication, though often difficult, is key.
Sit down as a group, as a family group, and talk about, this is what's going on. This is how I'm feeling about it. How are you feeling about it?
The Scruggs family learned this the hard way.
Now I had a recurrence 4 years ago, and my youngest son Wyatt was away at a boarding school for a semester program in New York City. And my oldest son and I decided together that we wouldn't tell him because we didn't want to kind of alter his experience while he was away.
It's kind of a harsh word, but I felt betrayed in a way. It just felt like they didn't think I was strong enough to handle this when I thought I was.
That was eye-opening too, because here I think I'm doing something good for him and that's not what he needed. So what I learned is to ask.
Jackie's daughter Ashley also found it difficult to communicate about the disease with her mother, but found closure toward the end. Jackie passed away in October 2014.
I think by the end, I'm gonna miss you, that conversation was one that felt very honest, but it was really a painful one to have. And so I think when she and I could connect to that, it was meaningful, but it was really hard. And so we didn't talk a ton about it, but when we did it meant a lot.
Along with communication, Chris Austin says another important coping strategy can be a person's spirituality.
Everybody has some spiritual component about them, because spirituality is not just about religion or faith. Spirituality is really about how you connect with yourself, how you connect with relationships, family, friends, how you connect to the universe.
Spirituality at the beginning, you pray for healing. Most certainly, it's okay to pray for that outcome that you really want. It's funny, just because God doesn't give you exactly what you pray for doesn't mean he doesn't answer really sort of precious prayers along the way.
Since Jackie's death, the Culver family has had to adjust to a new normal.
I know she's with the Lord, and she's not hurting anymore. However, it sucks for those of us that are here. I'm learning how to become single, and after 36 years of marriage, that's a difficult thing to do.
This pain's never not going to follow you around. Life will now forever be bittersweet.
For Bernadette Scruggs, she and her family live with a constant threat of reoccurrence.
Life now is, I will always be a cancer survivor. Just this past, maybe 3-4 months ago, I felt another lump. So I just thought this could be round 3.
I'm very set in my ways. I'm goal-oriented now, because I know that no matter what, even things that are out of your control can happen that can dictate and alter your life in an instant.
Nothing changes the toll of a cancer diagnosis on a patient and on their family, but experts say family members shouldn't neglect their own needs and instead seek support, communicate with one another, and build a sort of mental resiliency.
Cancer is a bully, and if you let it bully you, it will, and it will take over your life the way it takes over someone's body, and it behaves consistently with what it, emotionally, physically, so you have to have the boundaries for sure.